So this was a study that HealthSnap presented at the American Heart Association this year on the benefits of CCM with RPM. CCM stands for Chronic Care Management. It's a program for patients that have 2 or more chronic conditions. A HealthSnap clinical staff member will reach out to the patients at least monthly and help manage their care, as well as provide them with evidence-based care plan goals, such as things related to physical activity and nutrition, help them with their medications, their appointments, and other things that they need to coordinate their care. And the RPM program, remote patient monitoring, of course, is the monitoring of a physiological variable over time. And there are care plan goals that go along with that as well. In addition, there's feedback on the data trends and help patients get on track and improve their overall clinical outcomes. In this study, there were about 27,000 patients that were in the RPM only group, and there were around 10,000 patients that were in the dually enrolled RPM with CCM group. Both groups were highly engaged, meaning that more than half of the patients transmitted data for more than half of each month while on the program. And both groups had significant clinical improvements of around 10 points systolic and about 5.5 points diastolic. But we did find that the dually enrolled patients had a higher level of engagement, about a 20% greater transmission index and a higher level of engagement overall in the program, which translated into a small but statistically significant 1 point greater improvement in systolic and diastolic pressure. When talking to patients, anecdotally, they said that the CCM with the RPM program sort of complemented the RPM program. The data that would come in would flow right into those care plans that were shared with them through the CCM program. They also had an opportunity to connect more with clinical staff because they would meet with them more often, being that they were in 2 programs. So overall, we feel that the ability to combine CCM with RPM makes a lot of sense. It's natural that if you're helping a patient manage their care on a CCM program, that you'd like some sort of longitudinal data to go with it. And patients seem to really get even greater connections with clinical staff members. So we feel this provides a scalable model for the future of digital remote management of chronic disease.